On April 25th, 2015, an earthquake measuring 7.8 on the Richter scale hit Nepal. The earthquake killed over 8,500 people and injured over 20,000. The World Health Organization believes that out of the population of 28 million, 8.1 million people are affected, amongst which 1.7 million were children. Nepal's UNESCO sites were severely affected. The squares that house century-old temples collapsed, and in several districts, 90% of all buildings were badly damaged or destroyed. The task of rebuilding looked extremely arduous. According to the UN's OCHA's shelter cluster, 500,000 homes were destroyed and 270,000 homes were damaged. Nepal's Department of Education estimated that 25,000 classrooms were damaged or destroyed, and an additional 10,000 classrooms had minor damages that would leave 870,000 children out of school. Although the country's major road networks emerged unscathed from the earthquake, the inadequate progress in the transportation sector, coupled with the existence of only one international airport, became a major hindrance in the rebuilding process. The energy infrastructure was also on the verge of collapse, as there were daily news of landslides and closures of hydro dams that make up more than 90% of Nepal's energy production. The country was one more major natural disaster away from a complete collapse. However, if there was a silver lining to the devastation, then it was the way the young people of Nepal rose to the occasion and filled the leadership void created by the politicians. They crowdsourced funds for immediate relief, transported relief material to remote places, set up platforms for easy access to crucial information, and even worked in harmony with local authorities such as the Nepal Army and the Nepal Police. A generation thought to be out of touch with its country's needs took charge when the country needed it the most. It will be years before Nepal recovers from this 55-second incident. Regardless, the country is lucky to have motivated youth who want to help Nepal recover and make it stronger than it was on that dreadful day. We, the Global Shapers Kathmandu Hub, are proud to be a part of this movement. We hope to inspire similar movements amongst young people in Nepal. It would be an honor to partner with like-minded people to rebuild our country. In the next few minutes, you will hear about our Nepal Earthquake Relief Project.
On April 26th, the very next day after the earthquake, our founding curator Ms. Ashmi Rana, our immediate past curator Amod, a fellow shaper Vidhan, and myself met with young global leaders Dr. Shering Lama and the Honorable MP Mr. Gagan Thapa to discuss what we could do together in response to the earthquake. The Global Shapers Kathmandu Hub and the Young Global Leaders community in Nepal, from that point on, initiated the Nepal Earthquake Project. By partnering with Dr. Chering's organization Child Reach Nepal, we collaborated with the Nepal Army and the local government to ensure that the supplies we provided quickly went to villagers in need in Sindhu Balchok. Similarly, we partnered with the Honorable MP Gagan Thapa to channel relief materials to critical areas within Kathmandu Valley and to help us easily receive supply through customs. We quickly spread the message through our network that we would be setting up a collection point for relief items that we would be sending out to affected areas, particularly Sindhu Balchok district. All the young grassroots initiatives came together for an open discussion in Birua so that there would be no duplication of relief activities for us to work together effectively in a post-disaster context. Child Reach volunteers headed out on April 26th on motorbikes to provide basic first aid treatment and to collect information from hard-to-access areas in Sindhu Palchok district. Based on their information, we came up with a relief strategy and had coordination points at the airport for incoming supplies, collection points, a base in Melamchi, and a plan of how to send relief materials to more difficult-to-reach areas. In phase 1 of our project, we focused on relief, medical services, and transitional education services. We distributed relief materials to 14 village development committees in Sindhu Palchok, providing 7 tons of rice, 2 tons of lentils, 10,000 packets of biscuits, 6,200 packets of noodles, 2,500 tents, 1,000 blankets, and over 20,000 pieces of medicine. We estimate that approximately 12,500 households, or 50,000 people, received our immediate aid. The relief team mobilized 12 medical interns from the University of Science and Technology Chittagong in Bangladesh, a team of 28 doctors and nurses from Arogya Sevya, India, and 20 doctors from Fek, Nepal to go to Tipeni, an area where the community health post had completely collapsed. The group of 60 medical professionals worked from 2 bases in Tipeni and Melamchi and treated 4,000 patients in 5 days. The doctors divided themselves into smaller groups to penetrate hard-to-reach villages such as Lagarche, Borua, Bhotenamlang, and Manikarga. If a complex case was found, the patient was taken to the health campsite in Tipeni or to the medical base camp in Melamchi. On a few occasions, when the doctors felt that the health camp in Tipeni and Melamchi would be inadequate to treat the patients, they arranged for the patients to be sent to the hospitals in Kathmandu. Furthermore, Ms. Ashmi Rana facilitated the Fortis medical team to visit multiple affected areas to treat 5,000 patients in a week's time. We worked hard to collaborate with the Ministry of Education and the UN Education Cluster to build one of the first approved temporary learning centers in Nepal. Our first TLC in Melamchi is currently serving 80 children in the area. With the funds from the World Economic Forum team and Pathways, we supported the building of 20 TLCs in Sindhu Palchok in partnership with Child Reach Nepal. Furthermore, we supported over 40 temporary learning centers with stationery materials for 2,400 students, provided through a generous contribution from Hindustan Pencils. The temporary learning centers became a place for the families and community members to come together and heal from the trauma they experienced through psychosocial counseling and different family-friendly activities. Some of the strengths of our project include transparency, strategic partnerships, fundraising, and wide media coverage. We had an extremely successful Indiegogo campaign launched by Lokesh and his brother Aditya that raised over $200,000. We also opened up our Global Shapers Kathmandu Hub account for direct deposits or wire transfers and raised over $100,000. We've been touched by the response of the global community and particularly the World Economic Forum members who generously donated 20,000 Swiss francs. We promoted our fundraising efforts with media coverage through various international and national media networks, which helped to raise awareness about our work and also added to our credibility. Our work has been covered by international newspapers such as New York Times, CNN, Vice News, and NPR. As we neared the 1-month anniversary of the earthquake, we realized the need for us to reflect on the past month's work, to re-engage ourselves for phase 2 of our project, and focus on long-term rebuilding efforts.
By the time we decided to conclude the relief phase of the Nepal Earthquake Relief Project, we already had a long list of lessons learned. A key takeaway from that list was that if we want to achieve success on the ground with our efforts, we would have to focus on a few key areas and not just work on everything under the sun. Of all the things that we wanted to work on, the Kathmandu Shaper decided to focus our attentions on 3 key areas: women in health, education, and sanitation. The idea behind the Shaper Sanitation Project was to reach out to earthquake victims who were vulnerable to water and sanitation related problems. In the aftermath of the earthquake, sanitation issues had not received the kind of focus it needed. With the extent of open defecation near water sources that was prevalent, combined with the loss of personal hygiene items in people's damaged homes, the danger of a possible outbreak was quite imminent. A hygiene pack that would have personal hygiene items for the entire family would allow these members to practice simple hygiene-related exercises such as hand washing, bathing more regularly. The Global Shapers Kathmandu Hub worked to crowdsource, fund, and procure items for hygiene packs for 1,150 families in Malta Manikhel, Chandanpur and Kaleshwar village development committees in northern Lalitpur with the help of partner NGO Clean Up Nepal. Each hygiene pack consists of items like bathing and laundry soap, toothpaste and toothbrushes, sanitary napkins and other such items packed in a 10-liter bucket. Each hygiene pack would suffice for a family of at least 5 members and reached out to approximately over 7,000 people with the supplies. So far, we have committed and spent more than $14,000 to support Clean Up Nepal in preventing the spread of diseases in areas with limited access to clean water and toilets. As a part of the partnership with Clean Up Nepal, the organization will provide wash and hygiene training in the TLCs and schools we are supporting, as well as the community they are providing the materials to.
Education is a key area of focus for the Kathmandu Hub. We want to make sure that every single child affected by the earthquake can go back to school as soon as possible. The Hub has and is working on 3 education-related projects. In Phase 1, the Hub distributed stationery to over 40 TLCs. In Phase 2, we are working with our partners Pathway School and Child Reach Nepal to build 20 semi-permanent school structures. And finally, we are in the process of building a model school within the Kathmandu Valley. In Phase 2 of our relief efforts, the Global Shapers Kathmandu Hub collaborated with Child Reach Nepal and Pathway School of India to build 10 semi-permanent schools in Sindhu Palchok with 2 classrooms each. The order of the semi-permanent school was placed to Finish Profiles India, one of India's leading prefabrication construction companies, in early July. Even though there were several problems in receiving and transporting these structures because of the political problems in the Terai region, our partner has been successfully able to build the first 2 semi-permanent schools in Sindhu Palchok. We are hoping that the remaining 8 schools will be constructed in the coming months. The second big project that the Kathmandu Hub is being working on in the education sector is building a permanent school within the Kathmandu Valley. Currently, thousands of schools in Nepal are relying on temporary learning spaces to teach. There's a great urgency to move the students back into safe permanent structures. We will be rebuilding a historic government school in a sustainable model with the help of young global leader Honorable Gagan Thapaji and the Department of Education. During the design phase of the school, we'll incorporate provisions that will ensure that the school is a safe place during disaster and has sustainable provisions such as microgrid, solar power and rainwater harvesting. We are close to finalizing the school we want to work with, and once an agreement is signed between the Kathmandu Hub and the school, we will announce it to the entire community.
The area that we're reconstructing the health post in Sindhu Palchok is called Tipeni, on the border of Potinamlang and Lagarji. To cover a distance of 9 kilometers from Melamshi to Tipeni, it takes almost an hour and a half, even on a 4-wheel drive. During the monsoon season, the roads are inaccessible due to landslides left and right. The health post itself stands on a plateau with the Indravati river flowing on one side and the lush green hills of Sindhu Palchok on the other side. The team of doctors that conducted the health camp were shocked when they found the health post in Tipeni in rubbles. A 15-room structure had barely 1 room left, and yet the community workers who themselves were affected by the earthquake continued to help those who were wounded day in and day out. Seeing Indravati Janaseva Samiti's commitment to the health and well-being of their community members, the Kathmandu Hub decided to invest our resources in reconstructing the health post. We decided to follow the design approved by the Ministry of Health and Population, which includes the provision of a birthing center within the facility. The community members cleared the heavy rubble in less than 2 weeks, contributing their own resources, allowing our construction partner, Insulate Drywall, to build a solid foundation to place the prefab structure. In spite of the delays due to the monsoon and the current economic blockade, we are happy with the progress we've made and look forward to completing the health post as per our timeline in early December.
The Nepal Earthquake Relief Project was a major undertaking by the Kathmandu Hub. We owe our success to the countless number of volunteers and the over 2,000 donors who gave so generously to us. We've been overwhelmed by the amount of support that we have received from around the world, and especially from the World Economic Forum members and the Global Shapers community. Over the last few months, I've often thought about Margaret Mead's quote. She said, "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has." We, the Global Shapers Kathmandu Hub, have had the privilege to serve our country during its time of need. And I couldn't agree more with Margaret Mead that young, thoughtful, and committed citizens such as the Global Shapers will make Nepal and the world a better place to live in the coming days and years ahead. Thank you again for your support, and please do continue praying for the Kathmandu Hub's success.